whenever you're ready.
Yep. Hey guys, this is Ricky. Can you all hear me?
Yeah, I think you're
Uh,
good.
okay, awesome. Cool. So thanks everyone for sticking on. Nice to meet you all. So yeah, I'm Ricky Sahu. I'm the CEO of OneUp Health, and we've been working with bulk data in the wild and helped standardize it and ballot it through the HL7 balloting process, which happened, in September last year. And actually, the day after we did that, CMS announced that they would use the bulk data standard as the means to transmit data to health systems for all the Medicare data that they collect from the CMS US government side. And before I get into it, I'll cover a little bit about what OneUp Health is, what kind of brought us, the industry to this stage where now we're talking about bulk data, not just standardizing data. And then we'll go over how new requirements from the US federal government are pushing it even further forward and how organizations are using it in the wild today. So for those of you that don't know, OneUp Health is a healthcare platform organization that's connected to 10,000 health systems across the US. So we're connected via FHIR APIs directly, and any patient can authorize access to their full medical record via these connections. There are hundreds of companies using our APIs. We're doing thousands of transactions a second and have won numerous awards in the healthcare industry for FHIR server security, for privacy policies, health data provenance, and also for bulk data. And we work with large organizations like Boston Children's, Mass Mutual, Vertex, top payers, IBM, and the FDA as well. And yeah, so we've come a long way as an industry in this space. Just a few years ago, FHIR data being transmitted via patients over API was not even heard of. And now it's happening regularly. There are dozens of applications that have launched on the Karen Alliance Healthcare App Gallery. Recently, NPR uh, spoke about how organizations are reacting to COVID, and they mentioned how Mass Mutual is using OneUp and these FHIR APIs to connect to medical records. And now organizations like Boston Children's are working with and standardizing bulk data and actually interacting with it via these APIs and interfaces. And this is kind of just getting started. New rules from CMS and ONC under Health and Human Services in the Cures Act specified that both providers and health plans must start using bulk data interfaces so that they can transmit data at the population level to their downstream users that have the right to access this data at the population level. And the primary use case, once this data is being transmitted, is analytics. When you're interacting with data at hundreds of thousands of patients, tens of thousands, millions of patients at a time, you're going to want to run pop health analytics on top of it. And what's really interesting is that the previous regulations from CMS, which were Meaningful Use 3, required patients to be able to authorize access to their data for providers. It didn't have any mentions of bulk data or population level data transmission. But the new regulations are introducing bulk to the provider workflows, but they're now also bringing in claims data from health plans into the mix. So this is kind of the first time where we will have provider level clinical data, health plan level claims data together, but also able to be transmitted through this bulk data format at the population level. So you can quickly imagine using this for analytic use cases. And I'm going to share the rest of my screen, or my full screen. Can you guys still see this?
Yes.
Yeah, what we did was, as we were going through these uh, rules, implementing FHIR for these health systems, working with Boston Children's, working with the government to standardize these regs, or standardize these implementation guides, and seeing that they're presented in the regs. We are also working with the FHIR community to build bulk data sets that can then be fed into analytic environments. So here on our website, any of you guys can type into Google FHIR Analytics or FHIR Bulk Data Analytics, and you'll probably find this in the first couple links. We loaded up a data set of 1.2 million patients, 300 million records, across multiple different FHIR resources. And you can run really simple queries on this, like, show me all the IDs, birth dates, addresses, etc., of patients, and limit it to this number. But then you can run much more complex queries on this that are asking, can you show me all the children, between the ages of 13 or the age of 13 that got certain vaccines in the last year that live in Boston, and we already got results back. So this sort of data, bulk data, when pushed into the proper kind of backend data structures, can be extremely performant at millions of records. And even before you can say the question, you will get results back. So extremely performant, and can enable a ton of new functionality in the space. Stuff that we've already been doing, as in the industry has already been doing, but now can be done in more scalable ways. And let me go back to the slides. So yeah, these new rules, especially for health plans, they're introducing patient access APIs. So if this third party needs to have bulk data access, you could get data from multiple patients. Things like provider directories, which if you're a health plan or if you're a third-party app developer and you need to create a model where you can allow members to identify or find what providers would best be able to treat them across a number of health plans or across a number of health systems, you could extract this all in bulk and then put it into some sort of analytics interface like the one that we showed. And then payer-to-payer data exchange, which is also, CMS regulated health plans would need to be able to send data for their full population to another health plan. That still also needs to be able to be supported via the bulk standards. And CMS is really the organization that's been leading this space. They recently, or over the last year probably, they've been working on these two big initiatives. One is the beneficiary claims data API, and the other is essentially the full record of the patient from other health systems. And the way that these work is they both use FHIR-based APIs to retrieve bulk data standards for their Medicare patients. And the way that this used to work and still works kind of for legacy connections was there are 9 flat files that are transmitted called the CCLF data structure. And each of those files were essentially similar to different FHIR resources, but they were fixed width delimited. They're still getting you the data, but it was more of a one-off push batch process every month. And now you're in this situation where whenever there is new information, you can request a new pull of the member's records. So CMS, like I was saying earlier, they hopped on the bulk data standards very early, and now there are quite a few ACOs piloting these interfaces to get bulk data out from CMS and into their environments. And as we mentioned, analytics is the main use case here. So there are now a number of organizations using this data to analyze it and build infrastructure and applications on top of it. Most notably is Boston Children's, which first standardized the bulk data specification. And they also built tools on top of analytic interfaces, like the ones I showed, that allow you to interact with this bulk data in a performance scalable manner across various resources. So you could combine data from disparate health system EHRs and claims data sets at your health system if you needed to run analytics or joins across various data sources. And this is really interesting for things like care coordination or value-based care incentives, reporting requirements between payers and providers. And in fact, those reporting requirements between payers and providers was one of the primary reasons why CMS and Don Rucker were really behind these regulations. Another use case that's in production is basically the ability to, again, combine this claims and clinical data and create an environment where you can notify providers or practitioners about insights that you've generated on this bulk data analytics. And in this example, we're seeing that data from a large health system, clinical data, is transmitted to a payer, one of the top 4 payers in the US, and then they are running analytics on this data to then identify things like who are my patients that have gotten medications prescribed, and we can check because we're a health plan all the medications that patient has actually had dispensed and create notifications or alerts for those important ones that the patient should be on, but the patient hasn't gotten those meds dispensed. And you can imagine for a patient with diabetes, this would be very important because it would help keep them healthier for a longer period of time down the road. As a company, we think this is super important, and we think that it's super important for health plans to be able to meet new regulations, as well as app developers to be able to interact with these interfaces. From the provider side, EHRs are largely coming to solve this. So we believe that the Epics, Cerners, Allscripts, Athenas, et cetera, they will implement the bulk data standards as required by the regs. And for health plans, we're working with numerous health plans to help them meet the regulations and support these bulk data requirements as well. And we hope to see hundreds of thousands of patients getting data pushed through these standards so that the proper organizations, whether they're the payers, the providers, or the app developers, can interact with them and push machine learning and insights on top of this information. So yep, that's about it. I'm Ricky. Here's my email if you guys have any questions. We also have links to our website. Are there any questions in the chat?
Nope, I don't see anything in there just yet. Let me refresh again. Anyone on the call, if you have questions for Ricky, please go ahead and put them in that Q&A box. Or Ricky, if you're comfortable, we can have them open their mic to ask the question live.
Yeah, that's all good.
Okay, so if anyone out there has something, you can open up your microphone.
Yeah, and I think this is going to open up a lot of interesting topics from machine learning and AI types of tools that can then train their data on these bulk data extracts and produce really interesting insights for members and populations across various organizations.
Wonderful. Thank you so much, Ricky, for your time today and your
Yep.
presentation. And everyone, again, I'll just repeat myself, but if you have any more questions about this or you think of something later that you just didn't think of until you left, please go ahead and still post it in the Q&A, and Ricky can take a look at that later and help you out if you have any questions. But
Yep. Thanks, guys.
yep, thanks so much. And the next presentation will be starting in, I think, about 8 minutes. So thanks so much.